It's Saturday morning. The Experts program kicks off, and Luis Alvarez, CEO of the Alvarez Technology Group, is with us right here on Power Talk Radio. Luis, welcome back.
Thank you, Mark. How are you?
Doing really well. So you guys got some plans to head out to Paso this weekend, do a little wine tasting.
Yeah, going down to Paso Robles. We are members of a couple of good wineries down there, and they're having their member pickup party where they invite the members to come in and select the wines that they want to take home. And you get to meet with a winemaker and, just chat with the other members. And it's always a lot of fun, especially when the weather is nice. And it's probably going to be a little too nice. It's going to be about 100 degrees tomorrow in Paso. So it's going to be a little toasty, but it's a dry heat. So hopefully it won't bother us too much.
The Carmel Valley Fiesta is happening today, Saturday and Sunday at the Carmel Valley Community Park. And we've got the Run to the Sun car show, which is going on out there. And last time I checked the weather, Carmel Valley is supposed to be sunny and about 84. And I'm looking at it today. Yep, it's still going to be 84 degrees today. So that's going to be about perfect. But I do need to get a wide brim hat because I'll be out in the sun all day.
And it's also the weekend they do the Salinas Valley Food and Wine downtown Salinas.
That's right.
It was where we would have been if we weren't going down to Paso.
Well, I hope you guys have a great time.
Thank you.
Well, Amazon Clinic is offering telehealth services in all 50 states. Could it save you money? That's our topic for today. And first and foremost, what exactly is Amazon Clinic? Is this just an online service, or is there any brick and mortar element to it, or how does it all work?
So Amazon, as we know, and we've talked in the past, they've really been pushing into healthcare to kind of grow their footprint beyond just e-commerce, which is what they're known for, or live streaming and things like that. And they see healthcare as a big open opportunity for them, and in particular, delivering healthcare at an affordable price. So Amazon Clinic is a purely online service. It's available either as a email service where you can request help, or telehealth in terms of phones or video call. But you sign up at clinic.amazon.com, and it's free to sign up. There's no cost to it. And once you're there, you can choose to get help for about 30 common health concerns, things like asthma, dandruff, migraines, allergies, even erectile dysfunction, if that's what you need help with. And the idea is you pay a small fee, usually between $35 and $40 for the visit, but then they can give you prescriptions like any doctor and have those prescriptions go to your local pharmacy for you to pick up, or email or mail them to you if you want to use Amazon's own pharmacy service. So it's a very convenient alternative for people that either don't have insurance or have very high deductibles, so that they don't want to go to they don't necessarily need to go to a Mogo or Doc in the Box because they have something that they just want a prescription for. And it's easier to call somebody on the phone or go online and get it rather than taking all the time and trouble to drive someplace and wait in the waiting room till you get seen.
And so they're saying that this could be a real solution for people without health insurance, a way of delivering health care in a low-cost manner. Now, these are just consultations. If people need to see a doctor, then they've still got to go to a doctor, right? There is, or can they give references to medical doctors from this?
So I signed up to myself just to kind of get a feel for the service. And what will happen is, let's say you ask to speak to a doctor, and it takes between 5 and 15 minutes to get a doctor or a nurse practitioner online to work with you and diagnose what is going on with you. But if they diagnose it and they say, hey, you need immediate help, or you need help that we can't provide, they will tell you to go to urgent care or to the emergency room. But if it's something that they can diagnose, like let's say you have pink eye or you have the flu, and they can give you some antibiotics or antivirals to help with that, they can set up that prescription and, like I said, either send it to you directly from their pharmacy or arrange for you to pick it up at your local pharmacy that you use already.
Well, this could be a real benefit for people who live in states where healthcare is cartelized. Like in California, you're not allowed to have low-cost clinics offered by private operators. Now, we have government-subsidized clinics for the poor. In Salinas Valley, there's a couple, and I think there's even one in Salinas or a couple up there, and those offer free or very low-cost health care to people, but you have to meet certain income thresholds, and you have to be enrolled in a government program to be able to take advantage of those. So there's a lot of paperwork up front that someone has to do to be able to get into a program like that. Now, Now, in many states, big box stores like Target and Walmart have their own healthcare clinics inside, where you can pay as little as $35 to $50 for a physical exam. And I don't know if they take insurance, some of them might, but that's a low-cost model that's available to many Americans across the country. But unfortunately, in states like California, the lobbies, doctors' lobbies, and so forth have effectively been able to get legislation put into place that stops Target and Walmart from offering these same services in California, which, quite frankly, Lewis, I think we've talked about this in the past. Mm-hmm. This is the brick-and-mortar version of what we're talking about that Amazon is going to do, where people for a low price who don't have health care, who are not enrolled in a government program, can get health care. What I like about the Amazon model is that it short-circuits the attempts of the legislature to allow special interest groups to wall off or basically special interest groups go to politicians and they basically get them to create paywalls for them that people have to be able to get through. This is an instance where they can't necessarily stop this, and I think it's going to be a positive, particularly here in California.
We always talk about lowering the cost curve of healthcare, and it seems like every time public agencies delve into that, they end up increasing the cost curve rather than decreasing. So it's nice to see private industry saying, okay, well, let us take a stab at this and come up with a way to deliver healthcare that doesn't require a lot of expensive options for the consumer as well as for the healthcare provider. You know, emergency rooms don't like you to show up with the flu. They still have to treat you like they would treat any patient, and that's a very expensive diagnosis rather than just calling somebody and getting the Z-Pack online. So hopefully this will help with that.
Well, it's a really interesting innovation. If you want to read more about this, you can go online to Lewis's website, which is alvareztg.com, and there'll be a link there to the radio shows and the topics that we talk about on the program, so you can learn more about it that way. Online, it's alvareztg.com. At AlvarezTG is their Twitter handle. And Lewis, the toll-free number for the I-Team.
Give us a call at 866-78-I-Team. That's 866-784-8326.
Thanks, Lewis, and have a great weekend.
You too, my friend. Take care.